Although children most often develop swimmer's ear from swimming outdoors in oceans or lakes, adults can also develop this painful problem. In fact, swabbing the inside of the ear with a Q-tip after a shower can actually raise the risk of ear infections, since this removes the protective bacteria and also irritates the ear canal. The best way to handle swimmer's ear is to stop it before it even starts. Prevention is key, since once it develops it can be very painful and hard to treat without the use of antibiotics. Most drugstores carry over-the-counter ear drops that can help to dry up the moisture inside the ears. Protecting the ear canal with plugs or homemade wax substitute, and boosting the overall immune health with a healthy diet can also help to lower your risk of ear infections. Swimmer's ear, known medically as otitis externa, is an acute inflammatory infection of the tissue within the outer area of the ears. It's most often swimming related and can affect both children and adults. Most often it occurs when parts of the outer ear, known as the pinna, and the ear canal become infected. Just like other parts of the body that tend to keep moisture and bacteria trapped inside, like the nasal passage, spaces between the toes or the groin, the ears are susceptible to the accumulation of harmful bacteria. With swimmer's ear, tissue within the ears starts to get macerated from the ongoing wetness and moisture, and this leads to inflammation along with the build-up of bacteria. The throbbing pain and the trouble hearing associated with swimmer's ear infections affects about 3% to 10% of the population on a recurring basis. Additionally, about 2 million individuals every year experience swimmer's ear. Otitis externa is considered acute if it lasts less than 6 weeks and chronic when it lasts for more than 3 months. The swimmer's ear, otitis externa, is an infection of the outer ear, while other ear infections, like otitis media, are infections of the middle ear or the inner ear. Aside from the accumulated moisture and bacteria that's trapped inside the outer ear, other types of ear infections can be caused from things like food allergies, seasonal allergies, clogged ear tubes, or from travelling on airplanes. If you aren't sure what type of infection is causing your ear pain, look for other symptoms like congestion or blocked nasal passages, a runny nose, watery eyes, and an itchy throat, which can point to a food allergy or a cold. Here's a simple recommendation for helping you to know if the infection is affecting the outer, inner, or middle ear. Take the affected ear and wiggle it around gently. If it doesn't cause too much pain, chances are the infection is inside your eardrum and not swimmer's ear. If moving the outer ear triggers pain, then the infection is much more likely to be in the outer canal, which is a sign of otitis externa. Swimmer's ear is usually the result of prolonged moisture and warm conditions within the ear, which allows the bacteria to multiply quickly within the external auditory canal. In certain people, the protective barrier of the ears doesn't do enough to control the bacteria. Some cases are the result of someone coming in contact with bacteria from contaminated water, but surprisingly, most cases are actually caused by the accumulation of someone's normal ear bacteria. The root causes of swimmer's ear include low immune function and problems with the ear structure. Injury or trauma to the ears resulting in inflamed, chafed and cracked tissue. People with conditions like dermatitis and psoriasis can develop this problem more easily. Excessive cleaning of earwax can cause injury to the inside of the ear canal and remove too much protective wax. Hereditary factors like a narrowing ear canal can cause complications, which is why it tends to run in families. Swimming in contaminated water or public swimming pools can transfer bacteria that makes its way into the ear. The CDC reports that germs found in pools and other recreational water venues are some of the most common causes of swimmer's ear in children. Children suffer more from this issue than anyone else due to having lower immune function than adults, and also because their ear canals are more susceptible to keeping water and moisture locked in. As we get older, the parts of our ear canal change shape and they become narrower, longer and less prone to clogging up. The nerves in young children's ears might also be less developed and more sensitive. This makes them notice the pain more easily. Many children also develop ear infections that are different than swimmer's ear, called middle ear infections, because they spend a lot of time around other children, such as in settings like school or daycare, and this exposes them to more bacteria. High levels of inflammation and lower immune function among both children and adults, caused from things like a poor diet and food allergies, can also make this problem more likely. Most swimmer's ear infections are not contagious because they're an internal reaction to the build-up of the bacteria inside the ears, and they can't be spread from person to person. However, if it's caused from contaminated water, other people swimming in the same water are at a risk of having the same reaction. The most common swimmer's ear symptoms include itchiness in the ear pain, tenderness, redness, and pressure around the affected ear, hearing loss or changes, ringing or tingling in the ears, and trouble hearing normally, pus draining from the infected area, sometimes trouble sleeping on the affected ear, headaches, neck pains, and dizziness. With serious infections, it's possible to feel swelling in the lymph nodes on the neck. Swimmer's ear usually begins as an itchy ear and then slowly turns into more serious infection that causes swelling. If the itchiness is the only symptom that you currently feel, it's good news because the infection likely hasn't developed yet and there's still a lot of time to prevent one from forming. Using ear drops at this point and staying out of water can help to stop the bacteria from continuing to accumulate. Stay out of the water temporarily. Avoid getting into the water until after the infection clears up. And if the inner ear does get wet, use a hairdryer to dry it as soon as possible. You can soothe the pain with heat. To manage the discomfort, use a warm compress and press it against the affected ear. Try heating up a small towel in the dryer or the microwave, or using a warmed up water bottle and gently pressing it against the ear for as long as feels comfortable. If the pain is very bad, you can use over-the-counter pain medication like acetaminophen or ibuprofen temporarily. Avoid removing earwax as the earwax serves important functions, including protecting you from bad bacteria, preventing accumulated moisture, and providing a barrier to the inside of the ears. Avoid using cotton swabs inside the ears to remove the wax, especially if you're susceptible to infections. If you feel that you produce more earwax than normal and it's uncomfortable, talk to the doctor about safely removing the excess wax. You can essentially recreate the natural wax that's produced within your ears using a wax substitute like petroleum jelly. Swab a cotton ball with some petroleum jelly and then rub it gently inside the ear. This can help to absorb the moisture and to dry up the inside of the ear. Earplugs can be useful for people who are prone to getting water stuck inside their ears. Wax or silicone earplugs can be bought in most drugstores or found online. These types tend to be best for moulding them tightly to fit inside the ears. There's various types of natural drops that can be helpful, like rubbing alcohol, mineral oil, mullein oil and garlic oil, some of which have antibacterial and anti-inflammatory properties. A tincture that contains mullein alone or in combination with other herbs is commonly found in health stores. You can apply the drops or the solution that you prefer by first laying down with your affected ear facing up, pulling your ear up slightly to straighten the ear canal, and then gently applying 1 to 2 drops at a time into the ear canal with a dropper. Wiggle the ear to help the solution to work its way through the canal. Wait for about 30 seconds, and then get up and tilt the other side so the solution drains out. Vinegar, rubbing alcohol and mineral oil can also be very helpful for the ears, and they're easy to find. You can use either pure rubbing alcohol alone, or equal parts white vinegar and rubbing alcohol, or pre-made mineral oil inside the ears. Essential oils like garlic, basil and frankincense can be used outside the ears. Rubbing basil essential oil and frankincense essential oil behind the ears can help to speed up the healing of ear infections and reduce the pain. Although swimmer's ear is related to moisture and pathogen accumulation, believe it or not, your diet or your child's diet can directly be connected to the risk. There's certain dietary changes that can lower inflammation, raise immunity, and reduce your risk of various ear problems. You should avoid foods like packaged processed foods. These can contain added chemicals, high levels of sodium, dyes and other synthetic ingredients that both adults and young children can be sensitive to. Try to avoid most things in packages and focus on eating more whole, real foods. Some common allergens include conventional dairy, gluten, shrimp and peanuts, which can raise inflammation. Pasteurized cow's dairy products can be mucus-producing and worsen infections in the ears, throat and nasal passageways. Added sugar reduces the immune's functioning and can raise inflammation. Some foods that help to prevent infections. Research has shown breastfeeding newborns can help to lower the risk of a number of illnesses by improving their immune function. In fact, being breastfed is now considered one of the single most influential factors in raising children's immunity against infections of the entire respiratory system. If a baby drinks formula, switch to coconut or goat's milk based formulas, which tend to cause fewer allergies and less inflammation. High-antioxidant foods like vegetables and fruits of all kinds, especially those high in antioxidants like vitamin C, help to keep the immune system strong. They speed up the healing time and they raise resistance to future bacterial infections. Herbs and spices like garlic, ginger and turmeric have natural antimicrobial, anti-inflammatory and antibacterial properties. Water helps to clear mucus from the respiratory passageways and the ears. Wild-caught fish, which is high in omega-3, helps to reduce inflammation that can make infections more painful. Sources of clean, lean protein can help with immune function. These include cage-free eggs, grass-fed beef and pasture-raised poultry. Some supplements to help reduce the infections. There's the omega-3 fish oils, which have the anti-inflammatory properties. Zinc, which boosts the immune function and promotes healing. Adults and children older than 2 can take 10 milligrams twice per day. Vitamin C enhances the immune function and it lowers inflammation. Adults can take 1,000 milligrams 3 times a day, and children 500 milligrams twice per day. Echinacea increases lymphocytic drainage and it stimulates immune function. Vitamin D3 helps to support the immune function and controls inflammation also. Doses of vitamin D can range from 400 international units up to 5,000 international units per day, depending on age. Antibacterial and antiviral herbs like calendula, elderberry and astragalus can also be helpful. And probiotics help to improve the gut health and the overall immunity. If your child has ear pain and other symptoms that persist for more than several days, find a doctor who can help. Conventional treatments for the swimmer's ear and other ear infections include taking antibiotics to overcome the infection. However, it's best to consider antibiotics as a last resort, since taking them over and over again can cause antibiotic resistance. Sometimes antibiotics are necessary to resolve an infection, but in other cases, mild to moderate infections can go away on their own within around 10 days. Studies have shown topical treatments and ear drops alone are often effective at reducing acute otitis externa without antibiotics. Your doctor can help you decide what the best treatment approach is, depending on how bad your symptoms are. Swimmer's ear, or otitis externa, is an ear infection common among children, swimmers, people who clean the inside of their ears often with cotton swabs, and those with compromised immune function. Bacteria and moisture accumulation within the outer ear canal causes most cases of the swimmer's ear, but swimming in contaminated water and other health conditions like eczema can also raise your risk. Symptoms of swimmer's ear can include throbbing, aching, redness, swelling, changes in hearing and hearing loss, and sometimes pus or fluid dropping. To help to manage it at home, keep your ears dry with rubbing alcohol or a hairdryer. Use an earwax substitute. Use over-the-counter earplugs and eardrops, and apply essential oils near the ear to reduce the infection pain. If the symptoms don't go away in around 7 to 10 days, find a doctor who can help. To book a consultation or to learn about herbs, supplements and natural treatments, check out my website.